John, I'm here to discuss the results of the test that you took. And it was a Beck, what they call a Beck inventory. And you actually took 4 different tests that look at different areas that are interrelated to feelings of depression and thoughts of depression and hopelessness and anxiety. There's a few areas of concern, but the first area that we assessed were the severity of any potential depression, and you answered questions pertaining to the severity or potential for severity of depression. You also answered some questions concerning feelings of hopelessness. And this looks at your thoughts and beliefs about the future, what your motivation is, what your expectations are. It's a good indicator, John, of depression, possible thoughts of harming oneself or potential attempts at suicide. The other scale that was administered and that was assessed is the suicide, what they call suicide ideation or suicidal thoughts. And that detects the presence or the severity of suicidal thoughts, including any plans you might have, any protective factors, anything that you have in your life that might prevent you from following through or making plans for suicide or hurting yourself, and whether you're able to reveal any suicidal thoughts in general. That was the third scale that was assessed. Lastly, there was a scale assessed concerning potential levels of anxiety. And again, it assessed any severity of anxiety, the symptoms of anxiety, that you might feel in your body, okay, or that might be involved in your thinking, okay. So it could be physical, the results of anxiety through your physical body, or how anxiety presents itself in the way you think. So these 4 scales were used in what they call the Beck inventory, and your highest score, okay, the most the severe score was the depression inventory was very, very high. Hopelessness scale was considered in the moderate range, and the suicidal thoughts were considered moderate as well. The anxiety inventory was not as high and considered not applicable, and doesn't seem to be as severe as the other scales. But what's most concerning, John, is the levels of depression and hopelessness. And they are all indicators that you really are not feeling well. And I'm very concerned that these results indicate that you may not be feeling like you can keep yourself safe. And that's my big concern right now. On the depression inventory, you indicated that you would kill yourself if you had the chance. Yet the other Beck scale, okay, another Beck scale indicated that you had no desire to kill yourself, and that you would try and save yourself if you found yourself in a dangerous or threatening situation. What I'm going to need you to do, John, is to try and elaborate more about those thoughts. There's the thoughts or the feelings that you're having right now, because there's some contradiction there. And maybe there was some confusion. Maybe you were unsure how to answer some of the questions. So I would like you to elaborate a little bit more about those thoughts and feelings that you may or may not be having. in order to decide what direction to go with your treatment. Okay, it's very, very important that we proceed in a manner that's going to have your welfare and safety in mind. I am very concerned and worried about the scores and want to give you every opportunity to get on the right track toward feeling better and more hopeful toward the future. That's the most important thing, is getting you on the right track, feeling more hopeful so that you can build off of that. Thanks, John.